In this fireside conversation, we'll be exploring working with the body, mind, and somatic manifestations in transpersonal coaching. So before we get started, and I read Hennie's bio and then offer a few questions to initiate our conversation today, I'd like to suggest that we come together around the fire, as we do. So let's go ahead and imagine that we are approaching a fire in the middle of the wilderness. And we're each approaching this fire from our own directions, through the woods, through the forest, whichever your direction is. Of course, you may be coming from your physical location as you imagine approaching the fire. You may be coming from your professional background, whatever that may be. You may be a student, practitioner, researcher, or all three of those. So that may be your direction. Whichever your direction or position is today, the invitation is for us to join together around this campfire. So take a few moments, and if you like, you may close your eyes to hop into this imaginal scene setting, coming together. And before you imagine anything in particular, you may like to make sure that you're at home in your body by feeling the sensations of your breath, allowing the movement of air to anchor awareness within and around you. Feeling into the spaciousness of your breath in and around you. Feeling grounded, feeling present. And continuing now with the imaginal process of approaching a campfire. Warm flames going high. And as we each approach through the woods or forest surrounding this campfire, we take our place by the fire. And you can imagine taking a seat by the fire now and looking around and seeing the glowing faces of all those sitting in circle here together with you today. And even if you're watching the recording later on, join us now here by the fire. Imagining the glowing faces of all these souls radiating, curious, open, ready to learn, ready to explore. With that, if your eyes are closed, you may allow them to be open. I'd like to introduce our fireside conversation partner today, Dr. Hennie Geldenhuys. He is a certified transpersonal coach and trainer, hypnotherapist, and NLP practitioner. Hennie is also a medical doctor with an interest in integrative health and the emergence of the transpersonal in health and well-being. In addition to his clinical background as a physician and coach, Hennie has a wide experience in academia and research. He is an experienced trainer and facilitator in coaching, philosophy, methodology, and practice, as well as a research ethics trainer. Hennie is a personal tutor at Aleph Trust, and he teaches on the integrative medicine and transpersonal coaching psychology courses. Hello, Hennie.
Hello, it's good to see you all. Some familiar faces and all happy faces. So it's my honor to be here with you today. Thank you.
Thanks, Hennie. So in this fireside conversation with Hennie, we'll explore how coaches can work with physical symptoms and somatic manifestations. We will discuss ways in which coaches can bring an awareness of the mind-body intersection into the coaching space through our approaches, techniques, and attitudes. We'll demystify psychosomatic phenomena and conditions, and what role coaches can have in these scenarios from a therapeutic and ethical perspective. So to begin, Hennie, please give us a brief description of what we mean by psychosomatic and why it's relevant for coaches and facilitators to know about this.
Yes, thank you. Not an easy question, seemingly simple, but not that simple to answer. Because, I mean, here's the thing. I mean, I would like to start off with a sweeping statement. And I would like to say that all human experiences, any and all experience that we as a human being can have, are simultaneously and co-emergent, both physical or somatic, as well as emotional, as well as psychological, as well as cognitive, spiritual, and all the other domains for which we might not even have names. I don't think it's possible for us to have any experience that is not present in all of those different domains. So if you ask me what is the psychosomatic, I might say, well, everything is psychosomatic. By definition, all experiences are psychosomatic. Traditionally, when we speak about the psychosomatic, however, we often refer to physical, bodily, somatic manifestations of a process that is metaphysical in nature. For example, emotional, psychological, or spiritual. But a good starting point would be to say that the psychosomatic is really just our way of being, and it is perhaps focusing on one dimension of our being, which is how these things play out in the physical domain. Does that make sense?
That question and your response begins to sort of whet my appetite. And I'd like to dive in deep and sort of tease it apart and get to the meaning of what you've just proposed there, Hennie. So there are two highly influential books on trauma healing, that being The Body Keeps the Score by Dr. Bessel van der Kolk and The Body Bears the Burden by Dr. Robert Sher. These practitioners show evidence that the root causes of physical ailments are often the result of trauma and attachment problems. Therefore, what should coaches be aware of in sessions, and how can we approach working with physical symptoms and psychosomatic phenomena in a manner that fosters healing? That's a big one, Hennie.
Yes, it's interesting, and I'm really enjoying. There's a sort of a resurgence, isn't there, in the literature and in the discourse, a sort of a rediscovering in a way of embodiment practices. A lot of it, of course, is driven by trauma work, rightly so. And so, you know, it's fascinating, these authors and many others. What does this mean for us as coaches? Well, a couple of thoughts come to mind, right? I think the first thing perhaps is the way we started this conversation by saying that we appreciate the integrated nature of all experiences. So maybe that's sort of the first point. I think we as transpersonal coaches, or therapists for that matter, we need to hold the intention to bring the somatic into our coaching space as we would any other dimension. So it's this integrative nature of experience that I think is important. We have the experience as coaches, I'm sure, that clients often have issues, struggles, challenges, because they have in a way neglected one part of themselves. And often it's because they are neglecting their physical presence. their somatic presence. And so when we hold the intent to proactively address all the domains of our being, including the somatic, then I would like to think that is our formula, for want of a better word, in transpersonal coaching. We move towards holism, don't we? Towards integration. So perhaps an intention and awareness of the value of the psychosomatic is an important first step. Practically speaking, what does this mean in a coaching session? Well, we do certain processes that honor that integration of the somatic. And we can talk more about that a little later this morning. Processes. So in the way that we work with our clients, whether it be through a facilitated process or whether it be through more conversational means, we proactively and purposefully bring in somatic or physical experiences into the coaching space. So that's an important point. We can perhaps elaborate on that a little later. Here's another way that this becomes important to us as coaches. It's through observing our clients. I believe that the body speaks a language all of its own. And I believe that intuition and non-conscious material often express themselves through our bodies. So if we watch our clients very carefully, we can gain a lot of information. And sometimes the body says something completely different than what the words are saying. And so the client might say, when they're describing this particular issue, they might be holding their head, or they might be holding their chest, or some other random movement that is not all that random. And if we watch very carefully, and even in an online environment, this works very well, there are certain clues about where this process is going. So that's another way that we as coaches can learn from the somatic. There's a sort of a fourth way, I think, and that's how we are as coaches, how we hold ourselves. Firstly, I think it's important that we have a regular practice where we, for ourselves, integrate the experience of the somatic with all our other domains. It's important that we as coaches have an appreciation for how that works, so that experiencing the body is not new to us. But it's also how we hold ourselves in the coaching session. So, for example, physical movements. Are we making random distracting movements that are not resonating with my client in the coaching space? Or are we utilizing bodily movements? If my client says, well, I have this argument with my wife all the time, and they make a certain movement, or I have this and that, or I have that and that, this is my issue. And we notice that they have those bodily movements, whereas we would perhaps use their words in the coaching process. We can do the same with those bodily movements. So very often words come with actions, subtle bodily actions. If we as coaches can pick up on that, and we can use that in the coaching space to very good effect, then we are once again inviting that holism or integration of the entire experience into the way that we work. Those are some initial thoughts. Does that sort of help to answer the question as a start?
Hennie, I find it very helpful, and it reminds me of the value and importance of us as coaches, therapists, practitioners who work with individuals and groups, to refine our ability to sense and feel what's alive, what's present somatically, as well as what's alive and present in the field, in the space between practitioner and client. And therefore, the value of a skill that enables the client to have that quality of enhanced somatic awareness and spacious awareness, not only of the body, but beyond the body, seems to be an imperative in order to identify what is present, what's alive. There, as you might appreciate, there are people that are more visual. They see pictures and they express themselves in terms of the images that come to mind, and then there's those that might be more auditory in their information processing style, and they talk about how things sound. And then there'll be those that might be more somatic or kinesthetically oriented, and they're typically more in touch with their feelings. Nevertheless, this orientation of being somatically present so that we can work with sensations, symptoms, better understand the information that the body itself is trying to convey to conscious awareness, seems to be crucial. And that's what I'm taking from what you just shared with us there. Do you have any follow-up there, Hennie, regarding what type of skill, what type of presence on the part of the coach or facilitator maybe would enable the client to become more somatically aware in this way?
Yes. So, a lot of coaching or therapeutic approaches try and do this by numbers. It's like painting by numbers, as a child, did you also have that? You had this painting by numbers, and then each number had its own color, and it was lots of fun. But we don't do coaching in our tradition by numbers. Now, and I've seen a lot of approaches that try and spell this out. So they would say, look for certain eye movements, like NLP, for example, would say, or watch for certain body movements. Or if a client says that they have a particular physical complaint of a certain body part, then that means this, as if a certain body part is a clue to a certain domain or a certain problem. I personally don't think that our bodies work that way. I think very often it's random, it's seemingly random. There's not a specific pattern. We can't map out certain physical sensations or where those sensations are to anything else, because it's just so complex, so many factors that take a part. So if we start trying to cognitively tease this out, I'm not sure how effective that is going to be. I believe that the skill is in assimilating that intuitively. So how can we be as coaches to appreciate the somatic? I think by allowing a natural process to occur. We all have this ability that we have developed through thousands of years of evolution to be able to read other people's bodies. We need that to survive as a society, as a species. And so we are very good at that, I believe, right? I would like to think that as coaches, we can teach ourselves to augment that ability, not by painting by numbers, or trying to work out which movement is what, or what is, exactly how it's laying itself out, but rather to sense it, to feel it, to enhance our natural ability to hold that space and intuitively resonate with our client within that coaching space. In order for us to do that, we need to get out of our own way, which means we need to think where we need to think, we need to plan where we need to plan, but where we need to feel and resonate and experience intuitively, we need to be able to do that. So we need to practice that as coaches. We need to practice that on our own as part of our integrative practice, and we need to practice doing that in coaching sessions. And perhaps in a session, we need to keep reminding ourselves to just sort of absorb what our client is saying, absorb their bodily movements, observe how what they are saying is matching with everything else in the coaching session. So it's a space that we create, and we set the intent to allow what is a very natural process to occur.
Thanks, Hennie. So setting the intent in that manner seems like an important starting point. And you've spoken somewhat to the skill set that coaches, facilitators, practitioners can employ to sense and feel intuitively. I'm wondering if you can break that down any more for practical purposes. How do we go about doing that? Is there a particular approach we can take and share, maybe even impart to the client, so that they're able to gain that level of intuition, to be more aware of the body and its signs and symbols and so forth.
Yes, and I think that's important. There's lots of focus at the moment. It's a cutting edge in coaching and in therapy, embodied practices. Lots of really interesting stuff, research being done. It's a good time to be a coach, isn't it, or a coaching student? Lots of really interesting work being done in embodied practices. I have lots to say about this, so let me start. So firstly, just to recognize that this is an ancient wisdom, isn't it? When we talk about processes, embodied practices, working with the body, incorporating that into those processes, it's nothing new. We've all had bodies since we were born. All humans have always had bodies, and a lot of ancient traditions have incorporated the body into these type of ways of working, haven't they? So it's nothing new, but perhaps we are rediscovering it and reframing it in modern times. At the essence, I'm also a little hesitant to overcomplicate things, because I think when we impart this wisdom to our clients, sometimes we shouldn't be try and be too clever, because sometimes it's as simple as just inviting them to, at every opportunity, become more aware of their bodies. When you are moving, when you are sitting, when you are doing certain things, remind yourself just to check in with your body. It's as simple as that, isn't it? But having said that, we do need to recognize that there are many, many embodiment practices. So I like to classify things, because sometimes it helps me to understand things when I put it into a framework. In my mind, there are sort of 4 categories of embodiment practices. So think about practices that you do or that you know of, and perhaps where it might fit into this framework, although there's plenty of overlap, of course. There's a sort of a group of embodiment practices that I might call somatic experiencing. I'm borrowing that from Peter Levine, of course, who has this somatic experience approach. But it basically means that we observe in a mindful type of way how our body is. So perceptions of our body, the experience of our body, perhaps particular parts of our body, if that's appropriate, but we are observing and sensing and noticing and awarenessing our physical selves. And there are plenty of techniques around that. I can think of open awareness, soma-centered open awareness, for example. Kabat-Zinn's well-known body scan technique would possibly also be an example of that, where we invite perceptions or sensations from the body and observe them mindfully. There's a second category of embodiment processes that, for want of a better word, I might call expressive processes or creative processes, where we use our body to communicate or to create. For example, how about, theater or dancing? But I would put other approaches like yoga, perhaps, or Pilates, even Ajumi, perhaps, also in this category, where we are using bodily movement to express or to communicate, because our bodies are meant to move, aren't they? A third category of approaches might be the more integrative approaches that we as transpersonal coaches probably often use. For example, we would say to our client, well, when you have this recurrent thought pattern, tell me what's happening in your body. So we try and link a bodily experience to another part. And so by linking that, we're moving towards that wholeness or that integration. And so the type of practices that we can share with our clients might be around that. There's a sort of a fourth category that, for want of a better word, I might call sort of reconstructive approaches that perhaps work more with the non-conscious material through physical means, and that have a focus on trying to realign or refocus our nervous system, perhaps, and our muscles. So, for example, certain massage techniques, maybe acupuncture, coming to think of it, might fall into this group, where you don't necessarily need to consciously bring the material in, but you are sort of working with the body and you are helping to integrate that through contact with the body, basically, or being in the body's field. And so there are many and many of these practices. A good place to start in our tradition might be something like the open awareness soma process and demonstrating that to our clients, doing it with them, but in a way suggesting that they go and practice that on their own. It might be as simple as hearing from your client, what are things that they enjoy doing with their bodies, whether it be dancing or running or walking, and suggesting to them, helping them through a process of bringing awareness into that process. So when you go for that walk, or when you go for that run, or when you do your yoga, how about you discover ways of just becoming aware of how your body is moving? So we need to use our client's frame of reference and to not try and impose methods that we think are going to be appropriate, impose it onto them. That's the advantage of working one-on-one with a client, is that you can customize that approach. But I do think as coaches, it's important for us to be exposed to as many of these different techniques as possible. And of course, adapt them as we go along. So I wouldn't like to prescribe a particular method, but I would like to challenge you to think about this and to think about ways in which we can incorporate that into what is relevant for the particular client on that particular day, and invite them to come back and tell us about the experience, because maybe it turns out very differently from what they expected. And then we work with that, don't we?
Thank you, Hennie. I think that really begins to hit the nail on the head here, as far as my understanding is concerned. And two things you said there really seem to be the salient points here. The importance of an embodiment practice. So we as practitioners engaging in a practice that enables us to have an enhanced level of somatic awareness, and encouraging the clients to engage in a practice of their choosing. If they have a practice, maybe the coaching process helps them to commit to maybe extend or deepen that practice. Coaching can serve really well to help those clients to identify a practice if they have never had one, to work out together with the client what's going to be best for them according to their needs, time limitations, and so forth. So there's that practice element, but then there's also being client-centered within the session, and not trying to bring our preferred ways of working into the session, techniques or embodiment practices, but remaining present with whatever unfolds for the client. And now spinning back to a previous statement you said earlier, which is working with the non-verbal physiological expressions that coaches can identify in sessions. And probably one of the hallmarks of transpersonal coaching is that we don't just work with what the client says verbally, but we work with their non-verbal communication too, through our sensing, observations in open awareness, feeling, working with intuition as a legitimate way of knowing, and in identifying either within our own bodies, in the space between us, or the ways in which the client holds themselves or moves or doesn't move in a session, picking up on that and allowing that to inform our next move within the session, and allowing that to become an inquiry. So we might, for example, say to a client who seems to have retracted, distanced themselves, perhaps they seem to have gone blank or something like that, but they're not consciously aware of it. We could say, I'm noticing that you appear to have contracted or pulled back, frozen in some way. Is this observation of mine close to your experience? So it's an offering to investigate something with permission. And when delivered permissively in this way, there's a soft delivery that usually allows for the client to explore that, as opposed to saying, I'm noticing that you're frozen, so what's wrong? It might be a bit harsh and might not allow for the kind of receptivity in the relational process with the client that we would like to have. So helping the client to become consciously aware of what their bodies are communicating, that's the point I'm trying to make in response to what you've said there, Hennie. And in so doing, enhancing their somatic awareness, which creates forward movement and flow again in the session, and then works not in a client-centered way with their somatic intelligence, not just their cognitive ways of perceiving and knowing. Would you say that that is, have I picked up appropriately on what you've said? Does this have any validity?
Oh, yes, absolutely. Exactly. And because it resonates with our philosophy of integration. And once again, that statement that we started off with saying that any and all experiences are experienced in all domains at the same time. It's just that sometimes we aren't aware, or our clients aren't aware of how they are experiencing in a particular domain, but it is being experienced in all the domains. And so integrating the physical domain into a session, but also into a practice, has the advantage of moving towards that integration, but also it's a sort of sometimes it's a tool, it's an entry point, because let's say that our client have been so locked into a certain pattern of thinking that if we try and wrestle with that pattern, we might not get very far. But if we somehow, in a way, surprise them and go in by a side door through, for example, the somatic reflections of that repetitive thinking or that thought pattern in which they are held captive, by, for example, introducing the somatic, then we sort of give them a fresh way of looking at things. It's a sort of a reframe, isn't it? So not only is it important to integrate the somatic into the other domains, but often it's a very, very useful tool. I mean, I'm really excited, in fact, when a client comes and they don't refer to their bodily sensations, because I know that this is unexplored territory for them. So this is like an entry point that I can really use to their advantage in the coaching space. Sometimes, of course, it's the opposite. Sometimes I have clients that are so fixated on their physical symptoms that it's the opposite is almost true. You know, we need to look at the more metaphysical, emotional, perhaps even spiritual aspects. So it's not about favoring one approach over the other. It's about this idea of everything happens at all levels and all domains at the same time. And the more we can integrate all the different parts of our experience, the more likely we are to move towards a resourceful space.
That's really interesting, Hennie. Now, just picking up on this type of client who is fixated on the physical problem, the physical pain or the chronic sickness symptoms, and the reason for coming to a non-clinical practitioner, such as a coach, is because they're struggling because of the pain or the sickness or whatever that case may be. Yet we as coaches are not medical or clinical practitioners necessarily. Some of us are, but not all. So the majority of coaches who don't work in that clinical way, when physical symptoms present, what are the ethical implications that we need to be aware of and take into consideration when working with ailments of this kind?
Yes. It's an important question, which I'll address first, and then perhaps we could come back to this whole idea of so-called psychosomatic conditions, because it's important for us as coaches to be aware of that and how they present. But first, your very important question about sort of ethical conduct. This is a really, really important point. When you start working with clients that have prominent physical symptoms, we need to make sure that they are sorted out physically. Here's an example. This is a real life example. quite a while back, I worked for a client. I worked with a client. They came to see me for the first time. They had been through a range of alternative practitioners. For some reason, they distrusted the medical system. He had very irritable sort of symptoms, or irritating symptoms, he would call them. So it was sort of interfering with his lifestyle. So he had gastrointestinal symptoms like bloating and diarrhea and gastric pain and that sort of thing. And he'd been to all sorts of alternative practitioners over the course of months, right? And some of those approaches had helped and others didn't help. So I was next in line, but because of my medical training, as he was starting to explain his experience, there were certain red flags. Which I won't go into now, but there were certain red flags that, as a medical practitioner, would immediately worry someone. And I stopped the session. I said, well, you need to be sorted out medically. You need to go and have scans and scopes and that sort of thing. And sadly, it turns out that, in fact, he had colon cancer, right? And he passed away shortly thereafter. So, would it have helped if he'd been diagnosed earlier? Quite probably. Were those danger symptoms present when those other practitioners were working with him? For sure. And so I think we need to hold this awareness, if it's not within our scope of practice, that where necessary, alongside perhaps what we are doing, if there are prominent physical symptoms, please, they need to be sorted out medically by people that have a scope of practice that includes that. I'm not saying that we shouldn't work with clients that have physical symptoms, not at all, because I think we have a huge role as transpersonal coaches in working with the psychosomatic. But please respect your boundaries in terms of scope of practice, and make sure that your participant is, or your client, participant in the coaching space, is looked after, that we aren't missing something. Yeah. Does that answer your question, Jevon, about ethical boundaries?
I think that's crucial, Hennie. Thank you. Yes. And I'm thinking about those clients whose situation is really irritating them. And similar to your client's case there, they've been to see all these other types of practitioners. They've gone for scans and tests, and it's a classic psychosomatic manifestation. We cannot see anything in the MRI, the X-ray, this check, that test, you name it. We can't find the physical root cause of the problem. Therefore, the doctor tells me, it's all in my head. Yes, I can feel it over here or like that. And it's causing me these and those types of problems. Then where do we have value to offer? What's the best practice for us as transpersonal coaches there?
Yes. Yes. So let's talk about the so-called psychosomatic condition, which is a little bit of a misnomer, but classically, as you say, I mean, that's probably a better way of describing this. Sort of, let's call these medically unexplained symptoms, perhaps, instead of psychosomatic phenomena, because to me, everything is psychosomatic, like I've explained. But this is very, very common. And I'm sure it's happened to you, perhaps, or people, or you have clients who have these very real physical manifestations, very real symptoms. But the medical system finds nothing wrong with them. Like you're explaining, Jevon, they've gone for scans and all sorts of tests, and they've seen different specialists. And their interpretation often is, well, they're saying to me, there's nothing wrong with me. It's all in my head. But it's probably more in their body. And yet, yeah, you have this client, you have this patient who they still have this manifestation. And it's as if the medical system often lets them down in that regard. They fall through the cracks because the medical system says, well, it's not our problem. I'm so sorry, but this is, next, we can't do anything about this. But then also sometimes from the other side, so even the non-medical practitioners don't always know how to handle this, because it's as if we only see one part that is within our professional bias. Now, as transpersonal coaches, we don't have, well, I would like to think we don't have that same level of bias in terms of we are all about integration. We are all about holism. That's the role of transpersonal coaches in those group of medically unexplained symptoms. We appreciate that any experience is not only physical, but it is physical. It's not only spiritual or emotional. It's the other stuff as well. All experiences happen at all levels at the same time. And so maybe our client is fixated on a certain physical symptoms, and we need to help them through a process to realize that perhaps there are some emotional, spiritual, or psychological roots to this pain or the symptom, whatever the case might be. Very often clients they've developed a thought pattern where they are in tunnel vision in terms of their physical symptoms. And so it takes a lot of sensitivity on our part to help them through that process, because what they might hear is you're making this up, or it's all psychological, which it is partly, but it's still real, isn't it? And it's still a valid experience that they are having. And we need to perhaps help them to grow through this experience. Easier said than done, of course, very often, and we need to do it very carefully, very sensitively. But to come back to your question, I'm sorry, I'm answering this in a very long-winded way. What can we as transpersonal coaches do with those type of clients? We can support them, we can hold the space for them, we can practice our trade, which is using conversational altered states of consciousness to integrate the experience on all levels, and allowing those physical manifestations to become part of that healing process. It's as if sometimes with these clients, the body is just calling for attention and saying, here's an issue, I can't express it in any other way, so I'm expressing it through somatic means. Here it is. Let's work with this. I'm crying out for help, says the body, on behalf of the rest of this person's consciousness. And we as transpersonal coaches are listening out for that cry for help.
Thanks, Hennie. Yes, and it's interesting because, you know, when there is intense pain, acute or chronic, that's where attention goes. Yet this analogy of energy flows where attention goes doesn't seem to really hold up, because the attention that is fixated on pain is the quality of attention that doesn't want the pain. It's wishing it would go away. So it's seeing what's wrong with the pain and therefore experiencing what's wrong with the pain. And that's exactly what's holding the pain in place. It's part of the pain pattern, one could say. So the problem then is in the quality of attending. Energy isn't allowed to flow there because the channel of attention is so narrow. Therefore, if the quality of attending can change to a more open approach, and in transpersonal coaching, we're all about the practice of open awareness, opening the aperture so that the flow of energy can be more healing for the client, then not only do we bring more healing energy to what attention is being drawn to, in this case, pain, but we can also learn from the symptoms, because we're no longer stuck in that narrow way of perceiving. We're sensing and feeling the body as a whole. We're sensing and feeling the body in relationship with the sum of all of our experiences across the span of our life, the quality of our current experiences in relation to all the people and circumstances that influence us in this day and age. Open awareness allows for receptivity to all of these phenomena across dimensions, as you've put it. So if I may, my contribution would be that what helps the client to learn from the symptom is the quality of observing and witnessing that symptom in the state and perspective of open awareness. I gesture with my hands to the side so as to point to that open aperture of awareness as opposed to fixated attention. And that quality of attending within the frame of open awareness allows for healing energy and the opportunity to learn from the body. My preferred definition of the unconscious mind in this context is the collective intelligence of all the cells of your body. And the collective intelligence is greater than the sum of the whole. So we're tuning into our deeper whole intelligence by witnessing symptoms in the frame of open awareness, allowing for healing and discovery to occur. So I hope, Hennie, that that's a worthwhile continuation to what you've just said. I wonder if you have a follow-up.
Yes, very much, and that's exactly it, isn't it? And as Claire is also saying in the chat window, resisting the pain or suffering brings more focus or tunnel vision rather than opening and fully experiencing the sensation. There's a sort of a reflex reaction very often to physical symptoms, pain, suffering in general, to resist it, to deny it, to push it away. That's often not a resourceful way of dealing with it. When I work with clients with physical symptoms, psychosomatic symptoms, I invite them, in fact, to experience into the presenting symptom. So instead of running away from it, I help them to run towards it, strangely enough. In fact, as part of the process, I urge them to amplify well, not amplify the suffering, but amplify the sensation, whether it might be pain or fatigue or whatever the presenting symptom might be. Amplify it, experiencing, move into it. But importantly, at the same time, to create that what we might call warm dissociation that we use in transpersonal coaching, where we have this open awareness, where you can simultaneously be in an experience, but also observe the experience almost as if you're from the outside. So imagine being able to do that with a client who comes to you, for example, with, let's say, chronic pain, right? Chronic back pain, chronic neck pain, or any other physical symptom. Acknowledge that symptom, experience it into it, because as long as you try and push it into your unconscious, you're not really dealing with it, are you? So acknowledge it, amplify it, both experientially, but also cognitively. So instead of talking about it, experience it in its full glory, right? But at the same time, you are reframing it into the rest of your physical experience. So not all parts of your body are suffering at the moment, are they? You know, some parts are perhaps restricted, other parts are more relaxed. How about experiencing your body as a whole? And within that body, yes, you are experiencing this particular sensation. How is this different to everything else that you are experiencing in this moment? That's similar to Peter Levine has this approach of, he calls it somatic pendulation, where we pendulate or move between parts of the body that are constricted and parts that are more open. And so we bring the entire experience into the coaching process. And once you have this sort of association, dissociation effect going on, then it's much easier to speak to that particular sensation. It's much easier to, if it's appropriate for your client, to visualize it, to have some representation of it. And maybe once you start doing it and you're acknowledging it within this wider framework of open awareness, it starts to change, it starts to move. Maybe it says something, maybe it could be very random the way that it changes. It doesn't always make logical sense, but whatever's unfolding, you work with that. And it's as if once it starts moving, its meaning starts to change. And that's when healing can start taking place, not necessarily curing. So there was a question here from Jesse, are you saying that chronic pain is mostly psychosomatic? Partly, yes, but not necessarily completely. So maybe that pain doesn't go away. Maybe the outcome of our coaching session is not to take away the pain, but it's to integrate it into that client's entire consciousness, and so that they learn beyond just living with it, and beyond just managing it, but they sort of integrate it into their frame of reference so that they aren't fighting it anymore. I don't think all chronic pain is psychosomatic. I mean, people do have physical ailments that cause chronic pain. Of course, that's true. But then, of course, something like pain is not purely a physical sensation. Pain is a very complicated experience. It's not just one thing. It has a physical component, but it also has a psychological component. It has a neurological component, but it also has even a spiritual component or an existential component. So I'm not saying that all pain or all symptoms are psychosomatic, but all experiences have a presence in all those different domains. Once again, it's about integration, isn't it?
This is really great, Hennie. I love that we're getting into practical thinking and considerations here. And you mentioned Peter Levine, the somatic experiencing approach of pendulation between the part of the body or part of self that is not entangled in the symptom or problem. And the client's attention in that pendulation process is to shift between the aspect of the experience that is not entangled, in other words, what's not the symptom, where you're feeling relaxed and calm and safe, and then attention toward where the pain might be in this example, and pendulating between the two until that pendulation process diffuses the experience of the pain, and that in turn supports integration. And that would be the somatic experiencing approach in their technique. And a distinction here is in our approach utilizing somatic open awareness. We're not trying to find a part of the body where the pain isn't, and then to pendulate between the pain and the not pain. We're experiencing the pain within open awareness. So the pain is then one part of the self, one part of the physiology, and it manifests on other levels, as Hennie has clearly outlined now. But experiencing it in open awareness, which gives the self permission to experience the pain. And when there's permission to experience the pain, or as Claire already put in the chat window, then surrendering to the pain. And this is not a giving in to the pain. There's nothing I can do about it, so whatever, to hell with it. No, it's leaning in. It's allowing for the pain to be there as it is, which we can only do in a state of presence. We cannot achieve that in a state of tunnel awareness. It's the faculty of open awareness that allows for the capacity to lean in a state of curiosity and to feel that part of the self in which the pain exists from the perspective and experience of the whole self. And that supports integration in the same way that somatic experiencing pendulation does. We're not pendulating between not pain and pain. We're pendulating between fixation on the problem that we don't want to have and the whole experience of self, in which we can have a larger window of tolerance, a term coined by Daniel Siegel. So open awareness opens that window of tolerance, and in that larger framing enables us to be with the experience as it is, to have a greater degree of presence. And that's the antidote to fixated attention on the problem, where there's a small window of tolerance and the pain is always, knocking against that window. And that's why we're in resistance to it. And resistance is persistence. So we're opening the window through expanding our frame of reference. The larger window of tolerance allows for pain to be as it is, which in turn allows for healing and learning to occur. So that's our presupposition, one of our many presuppositions in transpersonal coaching that I believe has direct practical value. Hennie, does that?
Yes, that resonates very much, and that's a point that Kelly is also making in the chat window. I think it's when we resist these things, then they they become like a pot. This is just another example of different parts within ourselves, almost fighting with each other. It's when we bring the parts, and that pain, that physical symptom is another part. So in a way, this is also like parts integration, isn't it? But inviting that part to become part of the experiencing and reframing it in a way, isn't it? There's lots, there's this classic notion of, well, if you have chronic symptoms, if you have chronic psychosomatic symptoms, then you should meditate, and you'll meditate the pain away. But that's not true, is it? It's maybe meditation would help, but it's probably the reframing aspect of the meditation that is having an effect, what we would call open awareness. So I happen to think that our open awareness approach is very, very good for psychosomatic symptoms. It's exactly how we should be working, because as you say, Jevon, it contextualizes that particular experience within the rest of your experiences and within the rest of your being. And when you do that, you are not only listening to that part, but you're inviting them to be part of everything else. You're not denying them. You're not sort of trying to exile that part. You're inviting it to become part of the experience. And then invariably, in some way, the experience changes, hopefully, to become more resourceful. Yeah.
And at very least, the pain or the experience we were in resistance to becomes diffused. It becomes soft. It becomes something we can be with and accept, as opposed to being in resistance to. And that creates movement of energy for healing, and movement in the coaching process.
Yes.
And I think clients that say they don't feel anything, if they can just have an awareness of the body in which they don't feel anything and maintain an awareness of the body, even if there's no noticeable sensation at first, the very practice of open somatic awareness might be very revealing. If there's dissociation and numbing, which are the products of trauma, it's somatic open awareness that enables the client to realize, oh, this is a defense mechanism. And the defense mechanism is the responsibility of a part of me that is protecting me from something. So what is the something that it is protecting me from? What's the purpose of this numbing or dissociation? Where does it come from? These are questions that coaches can present to clients to the extent that they're in open somatic awareness. And so somebody that was contracted, retracted, numb, disassociated from their feelings can start to be with that experience, and in so doing, create movement and discovery. So in that way, we identify the parts and work with the needs of those parts. There's always something that's trying to come up into conscious awareness through the body. And by acknowledging that, we work with the body in a respectful way. Sorry, Hennie.
No, I was just about to say the same as you were going to say at the chat window. Yes, some good words of wisdom. So Olga, you might want to read what Olga and Jules has also put some interesting reads. So perhaps you could, everyone can read through that on their own. But Olga, for example, is saying that her experience has been that through childbirth, for example, natural childbirth, using this type of approach, you can have lots of success to that, and that's very much a thing, isn't it? That's a really, really good example. And Jules is also giving us a lovely extract in the chat window from Tara Brach that you might want to read through. So lots of words of wisdom in the chat window as well. There's just another thing before I forget that just came up, and we need to understand also that we aren't necessarily aiming to eradicate a physical symptom or a psychosomatic manifestation. So there's a difference, isn't there, between healing and curing. Curing is more focused on the actual sensation, whether it be pain, for example. It's focused on eradicating that single experience, removing it. Right. That's sort of curing. Healing is focused on the whole person, not on that particular aspect. And healing is focused on more integration and perhaps cultivating growth or a reframing, a wider experience around that. And so you could be cured, but not healed. But you can be healed, but not cured. If that makes any sense. It's like a riddle, isn't it?
Hennie, that's another really important point. We are aiming to foster healing, not necessarily a cure. I think healing allows for curing and promotes curing, but healing may also not necessarily eradicate a symptom. Nevertheless, the learning and growth that can happen through that learning process can be truly rewarding. And I can speak to my own experience in this regard, as somebody who's had a chronic sciatic nerve issue for a couple of decades now. And it bothers me quite a lot when I'm in tunnel awareness, especially when it's causing serious sleep deprivation, which tends to narrow that window of tolerance and patience and everything. So part of my practice from this teacher here in my left gluteus has been to be with it in open awareness. And I can attest to the value that it has brought in my life in terms of learning and growth. The cure has not yet been found, but I remain optimistic because it is the faculty of open awareness that guides me to find practitioners and to try out new things, many of whom I would never have met and experiences I would not have had if it wasn't for this precious teacher. And I've learned to frame the experience in positive terms rather than point toward that horrible experience that I want to go away, because that certainly doesn't promote healing or a cure. Yeah. So please, let's hear from you. Claire is a chiropractor and she's contributed rich comments and questions already. Claire, I wonder if you'd be willing to unmute and have your say so that we can hear from you.
Hey, Jevon. I was just saying in the comment, really just further to like what your interpretation of the pain is. So in childbirth, it's still hard work, but it's easier to surrender to that pain because you know the reason for it. And I think pain's often worse when people don't understand it, and so there's a fear around it. So so just wanted to make that point really.
I think, Claire, that's a really good example of a type of reframe, isn't it? Because when you can attach meaning to something, the experience become much more bearable. This is very much what the logotherapist teaches us, and Viktor Frankl, isn't it? It's all about meaning, isn't it? So it's finding meaning in the suffering, and then the suffering doesn't become suffering anymore. There's a difference, of course, also between pain and suffering, isn't there? We all experience pain. We will always experience pain. We should experience pain because that's part of the human experience. But it's when the pain is unresolved that it becomes suffering. So how do you move from pain to suffering? Perhaps it's by attaching meaning to something.
And also just having watched those guys on the Tour de France, I mean, they are in absolute agony, but yet they still push through and do it. You know, it's...
Yes. Yes.
Dan.
Thank you. I've really enjoyed today's conversation. It's very near and dear to my own heart in terms of kind of an embodied approach to coaching. And I guess I just wanted to bring it back a lot earlier, really, to what we were talking about in terms of signaling, you know, what we're picking up from our clients, and also what we're transmitting as coaches, and to kind of just re-emphasize or bring into the conversation the kind of layer below the kind of gross physical, to the kind of nervous system. Sorry, I've got frog in my throat, to the nervous system level. So, and to bring in kind of neuroception into that. So I think what I feel like I'm trying to do with a client is help us both discover a signal in the noise. And quite often a client's unable to find any signal because there's a whole lot of noise, whether that's nervous system dysregulation or a lot of thinking or a narrow fixation on pain, for example. So when I kind of always bring that in terms of, if you're engaged in your own personal embodiment practice, so kind of embodied presence, that's an immediate safe space creation in which their nervous system can regulate, in which there's less static in the system, in which it's much easier to access information at the somatic level. And so really I would, as a kind of technique, as a coach, the more grounded you are and the more this idea of being really here and really available just facilitates that in the client, and then that allows them to access the information that they're actually seeking in the body, when often it's so tangled in this mess of sensation and thought and static. So it was just that, really, just to bring that piece in.
I like that, Dan. And yeah, I mean, I like the fact that you also, what you're also saying is that this is, again, this is a very natural process. We have evolved to react to each other's body language, and there's lots of noise going on all the time, even though we might be saying nothing. There's a whole cacophony of communication going on all the time. A lot of it, most of it, is nonverbal, and a lot of it is through subtle body movements. And so, I mean, when last were you in a crowd of people, for example, that were stressed or that were worried, or watch their body language, but notice how everyone else is also being affected. And how often has it been? I've sometimes sat with clients or patients, and I notice in myself that I'm resonating with them, but not in a resourceful way. It's as if their anxiety is spilling over into me, and it's completely unconscious because I'm watching them. And from an evolutionary perspective, my brain is saying, listen, someone in the community is in trouble. There's something going on. You also need to be hyper vigilant, because whatever came for him is probably coming for you as well. That's what my sort of biology is saying. But if I don't watch myself, I'm amplifying the wrong things in my client, because I'm amplifying that anxiety. And so somewhere we need to break that cycle. And this is where, what you're saying, Dan, we need to be aware in ourselves so that we don't get caught into the drama of that dysfunctional part in my client, that I'm able to break the cycle and communicate to his or her body through my body that it's okay. This is a safe space. All right. So, it just calms things down a bit.
Yeah, and even below the kind of micro movement level, just at a biofield level, that co-regulation below the physical, but it's still a somatic relationship, is kind of what I was alluding to. And in that, you can, the more grounded in presence I am with a client, then my own sensitivity increases, obviously. So I can sense quite often what's going on kind of bioemotionally in them. And that gives us both access to more information. So it might lead to a better question from me, for example, because I'm sensing directly their experience, which again is an evolutionary fact that we can, that's how it's not just about what we can see. You can walk into a space and feel tension immediately, and it's not just physical cues. So he's just pointing to soma for me is a very kind of deep and broad experience. So it was just that, really.
Yes.
Thank you anyway.
I have been working with a lady, a friend of mine, for the past 2 years. Her son passed away in a brutal accident, and she's still very much in pain. However, I've tried to help her acknowledging the pain, but she still can't accept it. So every time we do a session, she feels better. She stops crying, she feels better, but then the pain carries on as she can't accept death. So what would be a good technique for me to end a session when I do a session with her? For her to look forward to when she starts crying or thinking about that non-acceptance that God took her son away.
Wow. I mean, I think it's a wide question, and you know, and obviously it would be contextual to your client. But I mean, in general, comes back to the question of pain versus suffering. There's always going to be pain, and the loss of a child or someone who's close to you is going to be painful, and it's never going to get less painful, because every time you think about this person, it's going to come up again. So that pain is going to be continuous. That's never going to go away. What we can influence is whether that pain becomes suffering. So it's how you react to that pain. First of all, we don't deny it. So, you know, it's no use saying to someone who's lost someone close to them, well, you know, life carries on. You just need to go on, because that's denying the pain, isn't it? What you can, however, start doing is to reframe what that means. So maybe start exploring a little deeper, because maybe it's more than just that. Maybe, now look, I'm just making things up here. Maybe there's some guilt involved. Maybe there's some existential issue, you know. So if that person could die so suddenly, then what is the meaning of life in any case? Or maybe I could have done more for that person while they were living. Or maybe there's some other completely other issue or part, shadow part perhaps, that is entangled into this pain. And the pain, in a way, is giving those shadow parts a gap to latch onto, and it's making it something more complex than just a simple pain of having lost someone. So, you know, I think it's important to make a space for that pain, but to explore why it doesn't seem to be resolving. Recognizing, of course, that we never quite get over the loss of a loved one. I mean, let's be honest about that. But we learn to bring it into, I suppose, our experience and a sort of a wisdom. That's my initial thought, Christina. But obviously, you know, there isn't an easy answer.
Yeah,
Christina?
that's what I explore with her. That her son was for her now the savior, the king. He was our minister here in our town. He was very intelligent, very kind. And we are all in shock that he died 1 minute to the other. He was very young. So it's a big loss for all of us, but for the mother, he was like second God. So she lost her son, plus all big hopes she had for him, perhaps to care for her on when she would be old. So it's a lot for her to take.
Christina, one other thing you said when you mentioned this all is that your client felt good in the session with you, and it's after the session later on when she's struggling again. So then the question in my mind is, what enabled her to feel good during the session with you? And perhaps the answer would be that she enjoyed your presence. There was somebody who was really there and listening to her, in which she felt held. And so then perhaps an approach might be, where else can she go? Who else can she connect with, so that she can surround herself by compassionate people to speak about and to just reflect with. Because obviously she got value in that time with you. And most probably some of that value is just through the quality of presence that you brought to the relationship with her. So you could also consider encouraging her to find others during this time of grieving, and perhaps even if it was a long time ago, people that she can share with in this way. And there's one thing she might want to also be aware of is, if after a long period of time, she's always the one who's seeking out the help of others who will hear her, then that relationship becomes a bit of a one-way energy channel, right? She's always receiving the energy. So there needs to be an energetic exchange in order to invest in the presence of another. Perhaps you'd like to do something so that they feel, because they might not be trained practitioners, these are ordinary people, maybe family members, so that they are inclined to dedicate time to her. So she needs to consider how she's going to exchange energy with them. It could be simple acts such as bringing a flower, taking the other person out for coffee, and then, she contributes something. That exchange is something else to consider.
Yes, that's what I even told her. I told her that, even invited her to come to the seaside with us, but she refused. She's very into her own world of God took her son away, and is there God, and why he died before her. It goes on forever in her head. And yes, as you said, she feels fine with when I talk to her, but then after, she relapses, she goes back. So I will take your advice, and next time I'll see her.
Yeah.
Well, thank you.
You're welcome. Kay adds the act of self-compassion. Yes, if she can learn self-compassion practices, then she can give that gift to herself every day. And that will go a long way too.
Yeah, lovely. Thank you.
If I may, there is just a question from Mary that she put into the chat window regarding the question of feeling the other or absorbing or taking them on. And Mary saying, can we speak to how we as practitioners can protect our space while being open? This is an important topic, probably a whole topic on its own, isn't it? But yes, we need to be wary of our own space, because as transpersonal coaches, we do open ourselves to the experience of our client and that coaching space. We don't section ourselves off like other therapeutic traditions. But we have to have a practice where we protect ourselves. However that might manifest for you, maybe you need to debrief within yourself after a session or before a session, or maybe there's some technique that you can teach yourself through open awareness to leave behind what you need to leave behind and identify what's yours and what's another person's, so that you don't take on some other person's energy. We're often highly sensitive people, as Jules would explain, and we tend to do that, don't we? We tend to absorb their energy. I think the important thing is to acknowledge that, to recognize it, and to develop ways that we dissipate that energy and work with it in a sense. But again, not through denying or pushing away, but perhaps the opposite, by having that greater awareness and just seeing it happening and not sort of trying to resist that when it happens.
Kelly followed the protocol so nicely and has been holding up her hand.
Hello, can you hear me okay? I haven't got my, yeah, oh good. I just wanted to share really quickly how I'm currently doing psychotherapy, and I'm using elements of open awareness and everything I've learned in the transpersonal coaching as well. And the clients that I see often are people, they've come because they've, as they would say, a lot of them say, I've pushed everything under the rug, so they've come and they're literally over flooded. It's driven them into their heads. They can't sleep, they can't eat. Anxiety is on a very heightened. And what I found really helpful is allowing to be empathy, and then drawing back from empathy and coming into a more compassionate place. So it's like a holding. So I'm noticing the space between us. But also the other part is sometimes I pick up on their bodily sensations. So there was one incident where I literally could feel it felt like my whole heart was like closing in. It was actually quite painful, but I knew it wasn't mine. But when I shared that experience, you could see almost like, I want to say, like a light bulb went off in my client's awareness, and it built trust really, really quickly, because they felt seen, and it actually opened their awareness up, because they found it really hard to connect with their body, so because they were so much in their heads. But by doing that, it almost created a bit more space, because they weren't just holding it by themselves. And then that allowed us, like, it was like a little portal to kind of explore what that was for them. Like, obviously I checked in, this is what I'm experiencing, and just wondering what you're experiencing. But then that opened up a lot more content to explore what was really going on underneath the overthinking. So I just wanted to kind of share my own experience of using my own body and being congruent with a client if it was for their highest intention.
That's a really good example, Kelly. Thank you.
Yeah, I might add, there's been a great thread conversation going on below Mary's question there about stickiness and the client's stuff. Dan added how open awareness and somatic awareness practices can make us less sticky to the client's stuff, their energy and emotions. Then gets felt, as Kelly has shared in her own example, but we're able to discern, which Yana also wrote, between what is ours and what is theirs. And in fact, I believe that it's in tunnel awareness where we're less discerning, when we're just focusing on specific details. Then there's so much that can come in through the back door, i.e. the unconscious mind. And that's where we unconsciously take on clients' material. And then it sits with us and we're not aware of it. And then we wonder why we're grumpy or headachy or just low energy later in the day. Whereas in open awareness, we're able to have more of a kind of martial artist's awareness of, I see you, there you are, here I am. We're in a sacred relationship. I'm going to allow you to come into my space with your, whatever it might be, martial arts. It could be a move, an attack perhaps. Yet I'm going to utilize that energy to create a momentum, the momentum that's already there. I'm going to utilize it so that it becomes something. And in martial arts, that might be a counterattack. But in coaching, it becomes your next move, coaching question, perhaps. So you've got to allow yourself to be receptive, to sense at that level, and to make decisions at that level. And in open awareness, you are a vessel. Nothing gets stuck, nothing sticks if it's not yours. In open awareness, their energy or emotions that get felt within the vessel of yourself pass through. And in your own grounding exercise, which you might do during the session, and most certainly by the end of it, then any residual energy that's sitting with you or sticking becomes grounded through intentional practice. There are several Jumi exercises dedicated to exactly this, grounding exercises, and many other practices that are useful for grounding or earthing those residual energies that may sit with the person, the practitioner, after the session. But a hallmark of the transpersonal approach is that we are open and receptive. We cannot block ourselves off to those energies, because otherwise, well, we're doing something else. But that's not the transpersonal approach. Yet there is safety in the larger window of tolerance, which open awareness practice allows us to have. And nothing sticks, nothing stays there. It's fluid and it flows and it becomes grounded.
So if you break a leg, you know a leg's going to get better, well, most of the time. Or if you have a baby, you know that pain's going to go. So being in that open awareness is quite easy, and to accept that pain and, you know, go through the breathing, that's all acceptable. But say somebody's going through like a past, like some trauma in the past, or they're scared of moving forward, or this fear coming through. So we can be present for that person and have the open awareness, but we still have to get back to the source or the root of that problem to actually stop that reoccurring in the body. That's correct, isn't it? Because otherwise that's just going to keep reoccurring in the body if we don't get to the source of the problem.
Julie, I'll answer that as a start. Yes and no. Yes and no. Yes, I think we need to go deeper, because there's obviously, there would be a pattern. There would be a learned pattern, often an unconscious or non-conscious pattern that has been learned as a reaction to that initial stress or trauma. So yes, absolutely. And I think that's what you are saying, isn't it?
Yes.
But no, in the sense that it doesn't necessarily mean that we need to focus on the traumatic incident. We don't necessarily need to go and explore the biography or the detail of that initial traumatic incident. What we are more interested in is the fallout. It's almost, I think we talked about this, I can't remember, it was recently, but we talked about the difference between a wound and the scarring. So we don't go and scratch open the wound each time and just add to the injury. But what we are interested in is the scar tissue around that traumatic incident, the psychological and neurological and physical scar tissue, in the sense that because of that initial trauma, our client has learned certain ways of being and certain ways of thinking, and that's what's causing their problem. So it's how it's presenting in the present moment, and that's what we need to work with. So you are correct that we need to address the underlying patterns that are supporting this particular manifestation. It doesn't necessarily mean, however, that we need to go and unpack the original traumatic incident, because we are interested in how it is presenting right now. Does that make sense to you, Julie?
Yes. So what you're saying is we've got to sort of change the thoughts around what's presenting.
Yes.
Yeah.
Yes.
Okay. Yeah.
The thoughts and the other domains of experience,
Okay.
the emotions and the spiritual and the somatic, the whole experience around that. Yes.
Yeah, and along those lines, in transpersonal coaching, we have one of our processes is a distillation of our entire authentic self-empowerment facilitation process, which is referred to as somatic memories, metaphors, and magic, SMMM. And in that process, the client is invited to hold the symptom or current manifestation of the issue in somatic awareness, and then to allow that symptom to transport their awareness to its root cause. And then we do not expect that the client is now going to regress to an earlier life experience, let alone past life experiences or anything else, although we allow for that possibility if that's what shows up for them. What we do is we completely trust their somatic intelligence to bring their awareness to whatever it is that is relevant and meaningful for them in that session to achieve healing. So we truly trust somatic intelligence in this way, and we get to a relevant and relative root cause, somatic experience, image, idea, whatever the case may be, that emerges into conscious awareness through this process. And that's then what gets woven into the coaching, so that the client can learn and discover whatever that is that's showing up, which represents the root cause for that session on that day. A future session might reveal another root cause, perhaps a deeper one, or another part at play. Perhaps one session reveals what in IFS is a protector part, and we get to know the mechanism of that protector part and work with it. And perhaps in a successive session, the exiled part in IFS terminology becomes revealed, and that could be represented as the deeper root cause. And in successive sessions, as rapport builds with the client, and as they learn to trust that process themselves more and become more fluid with that, we can go deeper and deeper, but at all times, staying present We're not regressing the client into a memory. We're never associating the client into a past experience. That's therapy. We don't do that. What we do is we hold space for the client to be somatically anchored in the here and now. And at the same time, as Hennie referred to earlier, having that warm dissociation from where they have that big picture perspective, an overview of their lifetime, which the sensation of the current somatic can transport their awareness to a root cause in the past, if that is relevant for them. And that might address scar tissue, the protective mechanism, or it might address or reveal the earlier initial wound, the exile. And we completely respect what the client identifies and communicates, and that's what we work with as it emerges in the here and now. So I'd like to take this opportunity to thank all of you for this participation, the energy, and this delightful, fruitful conversation that has emerged here in conversation with Hennie. Thank you so much, Hennie, for sharing your expertise and knowledge and everything with us today. So thank you, thank you all, and there will be more of this kind. Look out for the announcements. Thank you, everybody, and bye for now.
Thank you.
Take care.
Bye.
Thanks, everyone.